In the realm of cancer diagnosis, predicting a patient's response to treatment is crucial for improving survival rates and treatment outcomes. This task has been challenging due to the complex interaction between the patient's organism and the treatment. Recent advancements in foundation models, pre-trained through self-supervised learning on large-scale, unlabeled whole slide image (WSI) datasets, have shown promising results in pathology analysis tasks such as cancer diagnosis. This paper proposes a novel methodology for predicting the treatment response of diffuse large B-cell lymphoma (DLBCL) patients from WSI. The method leverages several foundation models as patch-based feature extractors, aggregating these features into a local representation of the image. A global representation of the WSI is then obtained by aggregating these local representations using attention-based multiple instance learning (MIL). This technique is chosen because only WSI patches representing tumoral or stroma tissue are relevant for predicting the response. The main contributions of this work include the proposition of a method for characterizing histopathology images by exploiting the aggregation of several foundation models, offering a better semantic representation of the tissue compared to standard CNN models. An experimental study conducted on a dataset of 152 patients shows the promising results of this methodology, highlighting the advantage of using foundation models compared to conventional ImageNet pre-trained models for the treatment response prediction task. The proposed method is distinct from recent work by Li et al., which uses a vision transformer model exclusively trained on their own private dataset. In contrast, the proposed method produces a prediction model that is not only trained on the author's dataset but also leverages representations learned from large-scale histopathology datasets through the use of foundation models. This approach emphasizes the potential of foundation models for characterizing histopathology images and generating more suited semantic representations for this task. The research paper presents a novel approach for predicting treatment response in diffuse large B-cell lymphoma (DLBCL) patients using whole slide images (WSIs) with hematoxylin and eosin (HES) staining. The task is formulated as a binary classification problem, where the goal is to predict the treatment response based on the patient's Deauville score. The proposed method leverages multiple foundation models, pre-trained on large-scale histopathology datasets, as feature extractors to produce low-dimensional embeddings from patches of the WSI. These embeddings are then aggregated using a patch-level aggregation function, defined as the concatenation operation, to create a single representation of the patch. This approach allows for the utilization of diverse representations induced by the foundation models and minimizes the risk of losing information. The aggregated embeddings are then treated as a bag of instances, and an attention-based aggregation function is applied to create a WSI-level embedding. This function assigns higher importance to patches that most contribute to the prediction, inspired by the work of Ilsa et al. The aggregation function is defined as a parametrized function, noted G, which takes the aggregated embeddings as input and outputs a weighted sum of the embeddings. The weights are computed using a neural network with a tanh and sigmoid activation function, which allows for the assignment of higher importance to relevant patches. The output of the aggregation function is a WSI-level embedding, which is then used to predict the treatment response. The proposed method is evaluated on a dataset of WSIs with HES staining, and the results show that the approach achieves state-of-the-art performance in predicting treatment response. The use of multiple foundation models and attention-based aggregation function allows for the effective utilization of diverse representations in relevant patches, leading to improved performance. The paper also discusses the limitations of the approach, including the lack of fine-grained labelization of the WSI and the assumption that all patches are not equally relevant for treatment response prediction. Future work includes exploring other aggregation functions and incorporating additional features to improve performance. Title: Utilizing Foundation Models for Predicting DLBCL Treatment Response. The research paper explores the application of foundation models in predicting the treatment response for diffuse large B-cell lymphoma (DLBCL) patients. It leverages a novel approach that aggregates patch-level features from whole slide images (WSIs) to predict patient outcomes. The study utilizes two foundation models, CONC and HIPT, which are trained on large datasets of histopathology images, and compares their performance with a standard ImageNet pre-trained ResNet 50 model. The proposed method involves a two-stage aggregation process. First, at the patch level, features are extracted from each patch using the foundation models and then aggregated using a concatenation function. This aggregated feature is then forwarded to an attention-based WSI-level aggregation function, which predicts the treatment response. The WSI-level aggregation function is the only trainable part of the method, along with the MLP classifier. The dataset used in the experiments consists of 384 WSIs from 152 patients diagnosed with DLBCL between 2010 and 2023. The treatment response is evaluated using the Deauville score, which is grouped into positive, scores 13, and negative, scores 4-5, responders. The experimental results show that the foundation models outperform the ImageNet pre-trained ResNet 50 model in terms of accuracy, precision, recall, and F1 score. The best performance is achieved when combining features from both CONC and HIPT models. However, the low specificity results indicate that identifying negative responders remains challenging, likely due to the lack of representativeness of the negative class in the dataset. The study also compares the proposed concatenation aggregation function with an attention-based aggregation function. The results demonstrate the advantage of fully utilizing the image representations offered by foundation models compared to learning an aggregation function for feature selection. The paper concludes that leveraging foundation models can significantly enhance the predictive capabilities of DLBCL treatment response models, highlighting the potential for these models to improve patient outcomes in clinical settings. Title: Exploiting Foundation Models for Treatment Response Prediction in Computational Pathology. Page 7. The comparative analysis of the treatment response prediction method, utilizing several foundation models in ResNet 50, is presented in Figure 2. The results indicate that the proposed method achieved superior performance across all metrics, particularly when leveraging patch-level foundation models aggregation, CONC plus HIPT. Notably, compared to the best results obtained by DTF-DMIL and TransMil, the proposed method provides a ROCAUC gain of 4.5% and 7.6%, respectively, and a specificity gain of 3.1% and 6.7%, respectively. Page 8. Table 1 compares the performance of different aggregation functions, with the highest value for each metric highlighted in bold. The proposed method outperforms other aggregation functions, such as concatenation and attention, in terms of ROCAUC, FS-score, and specificity. Figure 3 illustrates the comparison of multiple instance learning (MIL) methods with different feature extractors, demonstrating the proposed method's superior performance when utilizing foundation models and ResNet 50. Conclusion: the study concludes that exploiting foundation models pre-trained on large-scale unlabeled datasets with self-supervised learning has been successful across multiple tasks in computational pathology. The proposed method, along with the conducted experimental study on the new task of treatment response prediction, demonstrates that these foundation models have the potential to efficiently characterize histopathology images and produce more suited semantic representations than traditional ImageNet pre-trained models. Moreover, the aggregation of these foundation models enriches this semantic representation and improves the prediction capabilities. Further investigations on aggregation methods and the exploitation of new foundation models proposed in the literature are encouraged. The authors present a comprehensive review of existing literature on diffuse large B-cell lymphoma, DLBCL, a common and aggressive form of non-Hodgkin lymphoma. The references cited span various fields, including computer vision, machine learning, and oncology. The authors highlight the importance of accurate diagnosis and treatment of DLBCL, emphasizing the need for robust and reliable models that can predict patient outcomes. The references include studies on the use of artificial neural networks, ANNs, for predicting overall survival and molecular subtypes of DLBCL, Carreras et al., 2021. Other studies focus on the application of vision transformers for gigapixel image analysis, Chen et al., 2022, and the development of self-supervised learning frameworks for histopathology, Filiat et al., 2023. The authors also cite research on the use of deep learning models for DLBCL diagnosis and prognosis, including studies on the prediction of immunochemotherapy response, Lee et al. 2024, and the development of a visual language foundation model for computational pathology, Liu et al. 2024. Additionally, the references include studies on the use of radiomics models for predicting primary treatment failure in DLBCL, Santiago et al. 2021. The authors also highlight the importance of understanding the molecular subtypes of DLBCL and their impact on treatment outcomes. Studies such as those by Nowakovsky et al. 2015, and Sees et al. 2004, are cited as examples of research that has contributed to our understanding of the molecular mechanisms underlying DLBCL. The references also include studies on the development of whole slide image classification models, such as Transmil, Xiao et al. 2021, and DTF-DMIL, Zhang et al. 2022. These models have shown promising results in classifying DLBCL subtypes and predicting patient outcomes. Overall, the authors provide a comprehensive overview of the current state of research on DLBCL, highlighting the importance of interdisciplinary approaches that combine computer vision, machine learning, and oncology to improve diagnosis and treatment outcomes for patients with this disease.